candid-B cream. Composition: clotrimazole USP 1%, anhydrous beclomethasone diproate BP. Therapeutic class: broad spectrum antifungal plus steroid combination. Description: candid-B cream contains clotrimazole and imidazole antifungal drug for tropical use in superficial fungal infection. Clotrimazole was first synthesized in 1967 and has the chemical name 1-imidazole. The molecular formula of clotrimazole is C22H17CIN2 with a molecular weight of 344.8. The chemical structure is as follows. candid-B cream also contains beclomethasone dipromate that is corticosteroid used topically for its glucocorticoid activity in the treatment of various skin disorders. Chemically, it is B-chloro-11B, 17B21 trihydroxy, 16B methyl pregna 1 and 4-diene-3 and 20-diene-17 and 21 dipromate with the empirical formula. A molecular weight of 521.0 and the following structure formula. Clinical pharmacology. Pharmacodynamics. Clotrimazole and imidazole derivate extract antifungal effect by inhibition of fungal steroid synthesis. Clotrimazole appears of inhibit the enzymatic conversion of 2,4-methyl N-dihydrochlotrimazole of 2-demetazole, the precursor to ergosterol, which is an essential building block of the cytoplasmic membranes of the fungi. At minimum fungal concentration, clotrimazole causes leakage of intracellular phosphorus compound into the ambient medium with concomitant breakdown of cellular phosphorus compound into the ambient medium with concomitant breakdown of cellular nucleic acid and acylated potassium efflux. Its postulated action has also been described as restless in leakage of essential intracellular components, leading to inhibition of synthesis of such micromolecules as protein, lipid, DNA, and polysaccharides. Other proposed mechanisms for antimycotic activity of clotrimazole include alteration of plasma membranes, ATPase, alteration of other membrane enzymes, alteration in membrane transport and fatty acid metabolism. Pharmacokinetics. The pharmacokinetics parameters of the combination have not been evaluated. The pharmacokinetic profile of the individual ingredients is as follows. Clotrimazole. Absorption. Systemic absorption following use of topical clotrimazole preparations is very low. Estimated bioavailability is less than 0.5%. No clotrimazole could be detected in the serum and the biochemical monitoring remained uncharged in animals studied with cutaneous clotrimazole application. Distribution. Following topical application to the skin, clotrimazole cream is distributed in the Stratum corneum, Stratum spongium, Stratum papillae, and Stratum reticularia. Clotrimazole concentration achieved in the epidermal layers exceed the minimal inhibitory concentration for almost all pathogenic fungi. The highest level are achieved in the Stratum corneum and the lowest in the Stratum Bacilli papillae extraction. Absorption clotrimazole appears to be largely extraction in the phases primarily via biliary extraction. Renal extraction accounts for 0.05% to 0.5% of drug elimination. The elimination half-life of the parent compound 3.5 to 5 hours. Beclomethasone. The extent of percutaneous absorption of topical corticosteroid is determined by many factors, including the vehicle, the integrity of the epidermal barrier, and the use of occlusive resin. Topical corticosteroid can be absorbed throughout normal intact skin. Inflammation and or the other disease process in the skin may increase percussion absorption. Occasionally, resin substantially increase the percutaneous absorption of topically corticosteroid. Once absorbed throughout the skin, topically corticosteroid enter pharmacokinetic pathways similar to systemically administered corticosteroid. Any amount of beclomethasone that is absorbed is then metabolized by the liver and extracted by the kidney. The extract qualification data of tropically absorption of beclomethasone is not known. Indication: candid-B cream is indicated for the symptomatic relief and treatment of superficial fungal infection like dermatophytic infections. Candidiasis is of skin and tinea very color when accompanied by ascotomatous inflammation symptoms. It can also be used for steroid responsive inflammation, dermatosis, secondarily accompanied by fungal infections. Dosage and administration: the affected area should be washed with soap and water and dried thoroughly. A thin layer of candid-B cream should be applied to cover the affected area completely. The frequency of application is 2 to 3 times daily. Do not use for more than 4 weeks. For some patients, adequate maintenance therapy may be achieved with less frequent application. Adult use: candid-B cream should not be used for longer than 2 weeks for the treatment of tinea crucis and tinea croposis, and no longer than 4 weeks for tinea pedis. Products contain only antifungal agent may be used for infection requires in a longer treatment period. For the treatment of tinea crucis and tinea croposis, gently massage candid-B cream into the skin of the affected and surrounding area twice daily, morning and evening for 2 weeks. For the treatment of tinea pedis, gentle massage candid-B cream into the skin of the affected and surrounding area twice daily, morning and evening for 4 weeks. Candid-B cream should be not be used with occlusive resin. Use only on treatment lesion up to 10 cm in length or 100 square centimeter in area. Patient not showing a clinical response with 3 to 5 days should be re-evaluated. The duration of therapy varies with type of infection and extent of the disease. However, treatment of cutaneous candidation and most dermatoid infection usually requires 3 to 4 weeks. Pediatric use: candid-B cream should not be used for longer than 2 weeks for the treatment of tinea crucis and tinea compressis, and no longer than 4 weeks for tinea pedis. No more than 45 grams per week is recommended for the cream. Products contain only antifungal agent may be used for infants and requiring a longer treatment period. In children 12 years old and older for the treatment of tinea crucis and tinea cropis, gently massage candid-B cream into the skin of the affected and surrounding area twice daily, morning and evening for 2 weeks. If improvement is not seen after 1 week's recess condition, the product should not be used longer than 2 weeks. In children 12 years and older for the treatment of tinea pedis, gently massage candid-B cream into the skin of the affected and surrounding area twice daily, morning and evening for 4 weeks. If improvement is not seen after 2 week recess condition, the product should not be used longer than 4 weeks. Now, uniform gradients and available with regard to the use of steroid combination formulation in children due to a vast individual variability and clinical inconsistency, but all throughout topically, beclomethasone has been safely used in some infant and young children. Use of the some in children less than 5 to 6 years of age warrants extreme caution, a clear clinical indication that justifies the potential risk and strict medical supervision due to higher chance of precurrence, absorption, and systemic side effect. Use in children under 12 years old is not recommended because of higher risk of precurrence, absorption, and systemic side effect. Candid B should not be used with occlusive resin. The usage must be strictly under medical supervision. Laser dose and laser duration of therapy must be preferred in children. Use in special population. Pregnancy. Candid B should be used during pregnancy only if the potential benefit outweighs and justifies the potential risk. Avoid prolonged use in pregnancy. Clotrimazole. Pregnancy category B. There are no adequate and well-controlled study on the use of topical clotrimazole in pregnant women. Topically applied clotrimazole is well tolerated and there is no evidence of systemic absorption, embryotoxicity, or tetratrogenicity in various animal studies. Clotrimazole cream should be used in pregnancy only if clearly needed. Lactation. Exercise caution in nursing mothers since extraction in human milk is unknown. It is unknown if any of the individual concentrations of candid B are excreted in human milk. It is not known whether topically administration of beclomethasone can result in sufficient systemic absorption to produce detectable quantities in breast milk. But since most corticosteroids are secreted in human milk and the extract quantification of systemic absorption of beclomethasone is not known, a lactation mother should exercise caution. Pediatric use. Use of candid B cream is not recommended in patients less than 12 years of age. The usage in children must be strictly under medical supervision. Laser dose and laser duration of therapy must be preferred in children. Genetic use. Caution is recommended in elderly patients with the history of pre-existing skin trophy. Contraindication. Patient with hypersensitive to clotrimazole, beclomethasone, or any of the component of the formulation. Tuberculosis of the skin, chickenpox, herpes simplex, measles, vaccinia, and syphilitic skin lesions application might result in flare up of the existing infection. Warning and precaution. For external use only. Candid B cream is not for ophthalmic, oral, or intravaginal use. for therapeutic use only. The product should not be used for routine use or prophylactic purpose without the physician advice. Avoid use in large amount and the over large area of the body. Keep the drug out of the reach of children. Avoid contact with the face, axillaria, perineal region, genitalia, eyes, and mucous membranes. Discontinue the treatment of irritation develops. Certain areas such as face, groin, and cilia are more prone to arthropodic changes. Frequent absorption is important. Discontinue the treatment if irritation develops. This preparation should not be used in patients with tuberculosis of the skin, herpes simplex, chickenpox, measles, vaccinia, sympathetic skin lesions. Candid-B cream should be used with caution in the following group of patients. Patient with a history of allergy type response to other topically or oral corticosteroid because of the enhanced risk of sensitivity. Children may absorb proportionally larger amount of topically corticosteroid and be more susceptible of systemic toxicity. Patient with a history of pre-existing skin atrophy, peripheral vascular disease at site, reversible, hypothalamic pituitary adrenal axis suspension occurs following systemic absorption of topical corticosteroid. Clinical symptoms include Cushing syndrome, hyperglycemia, and glucosuria. An increased incidence may be observed with use of the more potent steroid. Use of medication over large surface area, prolonged use, the addiction of occlusive resin, and coexisting hepatitis failure following discontinuation of the drug. Recurring of the HPA axis is prompt and complete. Rarely steroid withdrawal symptoms occur and require supplement systemic corticosteroid. Patient receiving large dose of protein topically corticosteroid applied to extensive areas or under an occlusive resin should be evaluated periodically for evidence of HPA axis supervision. Patients receiving topically corticosteroid should be instructed to use the preparation as directed by physician only for the disorder it was prescribed and for no longer than the time period prescribed. The preparation should be used closely in patient taking constipated systemic antifungal treatment, diabetic patient with history of immunosuppression and immunocompetent patient. Drug interaction. No information is available on drug interaction with topical clotrimazole beclomethasone combination as systemic absorption is minimal. Drug interaction with concomitant systemic medication non-lucky. Overdose. Overdose with candid-B cream is unluckily if overdose is suspected. Medicated assistance should be sought immediately. Systemic absorption of topical corticosteroid has produced reserved HBA axis suppression manifestation of Cushing syndrome, hypoglycemia, and glucosuria in some patients. Children may absorb proportionally larger amount of topically corticosteroid and thus be more susceptible to systemic toxicity. If irritation develops, topically corticosteroid should be protein topical steroid applied to be large surface area should be evaluated periodically for evidence of HPA axis suppression by using the urinary free cortisol and ACTH stimulation test. If HPA-axis suppression is noted, then attempt should be made to withdraw the drug, to reduce the frequency of application, or to substitute a less potent steroid. Treatment appropriate symptomatic treatment is indicated in the event of overdoses. Acute hypercorticoid symptoms are virtually reversible. Treat electrolyte imbalance if necessary in cases of chronic toxicity. Slow withdrawal of corticosteroid is advised. Overdose with topical cortisol only prescription is unlikely. Studies have shown that topically applied cortisol is well tolerated and there is no evidence of systemic absorption. Oral studies have shown that in case of accidental injection, the drug in single doses is moderately well tolerated and in high dose has a strong emotional effect, which is protective. Storage. Store below 25 Celsius. Do not freeze. Protect from light.